Hello, everyone, and thank you for joining the Nucleus Marketing Agency channel. I want to say shouts out to everyone out and about making it happen. This conversation that we're going to be having is going to be about Medicare. For those who are not familiar with Medicare, Medicare is health insurance through the federal government. So the federal government has a health insurance program when you turn around about 65, or maybe you've been receiving Social Security disability for at least 24 months. Then after that 24th month, then you may be entitled to Medicare Part A, which is the hospital coverage. When you go to hospital, and Part B, which is the medical coverage when you go to doctors, your outpatient services. So I just want to give you a perspective on how Medicare works and how this information might be suitable going forward if you know somebody that has Medicare and want to know more about the opportunities they may have when it comes to their healthcare. So I've been a licensed insurance agent for about 2 years now and studying Medicare. Now, this right here, if you get Medicare, then perhaps every year, then the government sends you out one of these books right here. It's called Medicare and You. If you don't have one, you have Medicare. What you can do is call Medicare. Their number is on the back of your red, white, and blue Medicare card. If you don't have Medicare card, then the number is 1-800-633-4227. 1-800-633-4227. You can give them a call and request a Medicare in your booklet. In this booklet, you'll find information even about the Medicare health plans that are available in your specific state in your area that you can review. It'll also tell you about what's new and important with your Medicare options in the Medicare New booklet. So if you wasn't aware of this book, then this is something that you can call and you are entitled to receive. So you'll know about the changes of Medicare. Now, when it comes to Medicare eligibility, as I was mentioning, there's ways you can go about getting Medicare. If you turn 65, then you may be entitled to Medicare. Now, here's the thing: with Medicare, there are costs for the benefits. So you have Part A, which is hospital coverage. If you perhaps worked at least 10 quarters or pay, into the Medicare system for at least perhaps 10 years or maybe 40 quarters, paid into that, then you may receive premium free Part A. If not, then you may be subject to a premium if you may not have reached that amount. Part B comes is the medical coverage, which consists of being able to go to doctors, outpatient services, like emergency room and things of that nature. So with those services, you pay a what they call a Part B premium. For 2023, I believe that's going to be $164. They reduced that amount from last year, which was perhaps $170.10. So they kind of reduced that to maybe less than the cost of the Part B premium. So in a nutshell, just giving you a synopsis of how that works. Um, for those who may not be able to afford to, pay the premium or the cost, perhaps due to income status, low income. Let's say if you are paying the Part A premium, you didn't work enough quarters, or the Part B premium, you may perhaps be able to apply for programs that can assist you with the cost of your health care. A program called Extra Help, which is, through like the Social Security Administration and Medicare. It's a program that helps assist with the cost of your prescription drug coverage through your prescription drug plan, to where it reduces it to a certain amount and helps you with the cost there. You can apply for that by going to the socialsecurity.gov website, ssa.gov, and going through the website to find that application. But you can go there and apply for the extra program. There's also state programs such as Medicaid that members can apply for to see if they can assist. Now, there's levels of uh, Medicare Medicare savings programs. One program is what you call QMB plus. Okay, so that means that you're entitled uh, to full Medicaid assistance, as well as assistance with maybe cost sharing for co-pays, deductibles, co-insurance that comes along with the cost of Medicare, Part A and Part B. So QMB Plus maybe assist you with those costs in the event that you, you are ending up, having to pay out of pocket for that, and you may perhaps be in a hardship. Then there's, QMB. What I'm meaning by these acronyms, QMB is Qualified Medicare Beneficiary. That's what that stands for. And there's the plus. This means you have additional full Medicaid assistance alongside the cost sharing for your Medicare covered services. And then you also have, QMB plus, which may be cost sharing for Medicare covered services, co-pays, deductibles, co-insurance costs, but it does not offer Medicaid assistance, meaning you don't receive full Medicaid, just the cost sharing. You also have full benefit dual eligible, which is may be cost sharing in certain instances, but you also receive full Medicaid benefits, perhaps based off your income or your current situation. Then you have specified low income beneficiary plus. Now that doesn't it's cost sharing, but not, perhaps it varies maybe perhaps by the state how that SLMB plus work. And then you have SLMB, which is just strictly helping members pay the Part B premium. Okay, so something to kind of remember that. Now, if you have Medicaid and you may not have heard of these terms, then perhaps now you may be more aware if you ever received or called in to review maybe like a Medicare health plan, and maybe an agent asks you, do you have Medicaid? Now you perhaps know, yeah, I think I have, my card says here, or I checked it out, and now I know that I have this level of Medicaid. So there's another level of Medicaid as well, which is they call qualified disabled working individual. I'm just kind of going out the noggin with this. Perhaps that is it helps pay the Part A, I believe. It's Part A. I want to do some further research. It kind of sound like I'm not knowing what I'm talking about. But these things are available for members of Medicare to take advantage of, and sometimes they may not be aware of these programs. So I just want to put it out there, from another perspective. Also, there's Medicare, what they call Part C. Medicare Part C. I want to explain to you how that works. So Medicare has extended the benefits of Medicare to carriers of private health plans, contractually. So they have to abide by the standards of Medicare, but they have a way of making sure a member can be able to have affordable coverage through private health plans, through carriers. Some plans have what they call networks. So with a Part C, a Medicare Advantage plan, what they call like a Medicare Advantage plan, HMO, a Health Maintenance Organization. We have a network of providers that are contracted through the carrier to provide you with medical services at a negotiated fee, as long as you are staying within that provider network. So, an example may be if you ever received a summary of benefits from a Medicare Advantage plan and you read that version of your summary of benefits, you see, let's say, doctor's visits. It says perhaps, let's say your copay to visit your a primary care physician is $0 in network. Then the PCP, a primary care physician, may be assigned to you because you may be assigned a primary care physician if you may not have one. And if that primary care physician is in your network, then when you go visit them, the billing will be $0 as far as the cost on your end. The plan covers a share of the cost, and you cover the rest of the cost. And if your copay is $0, that means you pay zero cost. Let's say if you're a doctor, your primary care physician is not in that plan's network, then you may be subject to what they call out-of-network costs. So meaning that the plan may not cover those costs. And you may be responsible perhaps for 100% if that provider is not in the plan's network under your HMO, your health maintenance organization plan through that carrier, if that makes sense. So there are some, like I say, advantages with Medicare health plans. And then you have what they call a PPO. With the PPO, that's a preferred provider organization. So that offers more flexibility when it comes to being able to manage the care that you need or want on your own. You don't necessarily need to have a primary care physician assigned when you have a PPO. However, it is encouraged that you have a primary care physician in the plan's network that you can refer to should you may need to just get access to the health without any having to call and see if any other provider is in the network or out of network. And when you have a PPO, you are able to go out of the network as long you can see any provider, as long as they're willing to accept the plan and accept payment for the plan and the plan's terms. And they may be subjected at a higher rate than an in-network provider, then you'll be able to see those providers. So PPO offers flexibility. There also are plans that include prescription drug coverage as well. So with Medicare Advantage Part C plans, they perhaps may include prescription drug coverage. Some plans offer, you may have a deductible when it comes to medication. Some plans may waive that to where you may not have a deductible. It just depends, on the plan and the benefits they offer. They also have tiers. Tier 1 can be considered a preferred generic, the most commonly used medications. You may have a tier 2 as a non-preferred generic, which may be perhaps at a higher cost than what a non-preferred medication may be. Then you have what they call tier 3, which is a preferred brand. It can be a brand name or maybe a generic, but maybe higher quality ingredients than a tier 2 generic would be. And then you have tier 4, your non-preferred medications. Again, maybe more expensive ingredients than the tier 3, but based off the formulary, these particular medications that are classified in this tier are perhaps more expensive on the cost side than a tier 3. Tier 4 tier 5 is your specialty tier medications. Maybe think of like cancer medications or multiple sclerosis medications. These perhaps only come in a 30-day supply because they're such a specialty medication, maybe something that's rare and hard to make. So those are on the higher side as far as cost when it comes to the tiers of medication. So that is, perhaps all included with plans. And then you have like tier six, which is select care medications, perhaps like maintenance medications for diabetes and things of that nature. Um, Sometimes are also on tiers. When you have extra help, this extra help can help you depending on the level of extra help. 100%, perhaps can pay to help pay the Part D premium, as well as the prescription drug costs. You have 75%, so it may pay 75% of the Part D prescription drug premium, as well as the prescription drug costs. 50% and so on. So you get my drift on that. So these are things that you can be aware of going forward, so you can kind of be more informed about your options when it comes to Medicare. Um, in the synopsis, if you have like both Medicare and Medicaid, it makes you dual eligible, and there are some dual special needs plans when it comes to Part C Medicare Advantage plans. They may offer you perhaps additional assistance. Um, these special needs plans are designed for maybe people dealing with chronic conditions or conditions where mobility may be impaired, so they perhaps offer you more transportation. There may be plans that offer you benefits such as maybe flexible assistance, maybe helping pay for rent or groceries, fitness memberships, lots of other special supplemental benefits that you may be entitled to with dual special needs plans. So, and then there are also other plans out there as well, like supplements, Medicare supplemental plans. So these plans kind of maybe cover the cost of what Medicare doesn't when it comes to your coverage. Supplemental plans, um, from what I experienced from some of the people I work with, they mentioned to me the reason they have a supplemental plan because they don't want to be, situated with copays sometimes. They want to perhaps have a plan where they pay maybe a higher premium, but when they go to a doctor or specialist, their copays are non-existent because maybe the supplement covers the cost there, or hospital. They may have went to the hospital. I have a client tell me one time that because of their supplemental plan, they had a surgery in which racked up to $1 million. They didn't have to pay perhaps a penny of that because of how their supplement was set up. So it kind of assists you with the cost of what Medicare doesn't cover, like co-pays, co-insurance, deductibles, depending on the type of supplement that you have. You still will have to perhaps ascertain your prescription drug coverage, as well as maybe some dental or vision if you wanted that. These are the benefits that are also included with certain Medicare Advantage plans. So you don't have to have any standalone coverage. You can get it all under one coverage, which is usually what a Part C Medicare Advantage plan is going after, to have your coverage all in one. So you just show one card with a supplement. You still have to, if you wanted that coverage, come out of pocket perhaps to get those additional benefits. But supplements are known to, kind of waive a lot of costs for people if they don't want to go down that road with a Medicare Advantage plan. Another important note I like to add is that there are elections throughout the year with the Medicare health plans. I just kind of want to make you aware of how that works. So currently, we are in January of 2023. So from January the 1st to March 31st of 2023, is like the open enrollment period, in which for members who have Medicare Advantage plans, looking to change perhaps into another Medicare Advantage plan, or perhaps believe looking to drop what they have now, and go back to original Medicare, maybe a time where you can do that. So if you have, let's say, for instance, you have a Medicare Advantage plan and you want to change to another one, then you have that one-time election that you can use, the open enrollment period, to do just that. Make a changes to another Medicare Advantage plan, whether it be a Medicare Advantage only plan, where it's just specifically, Part A and Part B coverage services, along perhaps with other additional benefits, but no prescription drug coverage. Or you may want to change, from just a Medicare Advantage only plan into a plan that offers a prescription drug coverage. We're doing an open enrollment period, January 1st until March 31st. You have that election to do so. If you have not already maybe used it to make a change to a plan already, then you may have to perhaps maybe look at other situations that may prompt you to be able to make a change. So there may be other circumstances. Perhaps maybe you are in you just became eligible for Medicare. You just got a red, white, and blue card, and it says, let's say your Medicare will go Part A and Part B says on your card effective dates February the 1st, 2023. You haven't signed up for any plan, well, you're in your initial enrollment period where you can either perhaps sign up for a prescription drug plan only or a Medicare Advantage plan that offers prescription drug coverage included, or you're in what they call like the Medigap stage where you're able to actually enroll into any supplemental plan without having to face any underwriting scrutiny when you're in your Medigap. So you have about 6 months from when you're entitled to Medicare, and then 6 months out to be able to enroll into a supplemental plan without being, scrutinized for underwriting. Find a plan that's a supplemented and you want it, get in it, you make your payments, and that is your plan. Now, let's say if you enrolled into a Medicare Advantage plan, right, for the first time, and you wanted to experience a supplemental plan. As long as you do that within the year of you first being entitled to Medicare, you'll still be able to roll into a supplemental plan, perhaps on a guaranteed issue, which we can dive more into that on further videos if you may find this appealing. Now, to all my veterans out here that do, that works with Medicare health plans and things of that nature, if you have any points for me, let me know. I'll be glad to take that input and become better with it. I'm just kind of give you a synopsis because I've been doing Medicare telesales for about 2 years. So kind of just giving you information if this helps you further understand what it's about when it comes to Medicare. Hopefully y'all can hear me okay. If not, I've just been talking in silence for about 23 minutes now. So it's very important for you to know it's okay if you may not understand all the information that comes along with Medicare and Medicare health plans. That's what we're here for, to kind of help you understand it. So if you'd like to know more about Medicare, please feel free to leave a comment. Medicare health plans, I don't work for Medicare, I'm affiliated with Medicare. I just wanted to kind of inform people how Medicare works from a person who's been licensed for about 2 years now, studying it and really understanding how this works. This right here, I know it's 2022, but I'll get to 2023. But this is very important. I've read this from cover to cover many times to get a real understanding on what I can do to improve the health beneficiaries of Medicare, understand their options. So I'll just leave it right there. I'm not going to talk your head off, but I will keep you up to date on stuff just like this. You go to my channel, please like, share, and subscribe. and I got all kind of content for you. I do thank you. If y'all have any questions, again, uh, put the question in the chat, and I'll definitely respond. All right, till we meet again, my friends. You are now part of the Nucleus Marketing Agency. Peace out.